Today, I am presenting an advocation for change to promote the mental health of nurses within the intensive care unit, or ICU. COVID-19 has affected millions of people throughout the world, starting in 2020 and well into 2022. The pandemic has affected healthcare workers, especially nurses who have fought on the front lines to save countless lives. Throughout this course, the clinical issue that has been explored lies within the mental health area of nurses. When forming the clinical question, the main goal was to find out how mental health of nurses were affected by the pandemic and how research can aid in supporting nurses in the future and supporting their mental health needs and furthermore. The clinical problem that was explored was how the pandemic affected the prevalence of post-traumatic stress disorder, or PTSD, in nurses specifically working in the ICU. The research that is available about this subject explores the quantitative data of the prevalence of PTSD in nurses working in the front lines. For example, there are some research studies that compared pre-pandemic numbers of PTSD rates in nurses with rates of PTSD in nurses during the pandemic. And these studies showed an increasing trend. So the rate of PTSD in nurses increased throughout the pandemic. However, a few articles that were used in literature review mention that the mental health of nurses needs to be explored, especially the mental health issues that occurred or developed throughout the pandemic. One study in the Journal of Traumatology explored a similar clinical issue. The researchers suggested that the physicians who care for nurses, or who are their primary care physicians, should be implementing mental health screenings during doctor's visits. They also recommended that physicians should be trained in caring for nurses who specifically are on the front lines. With this information, I would operationalize changing the prevalence of PTSD in ICU nurses by implementing mental health screening protocols within the institutions that provide critical care or have ICUs. I would also implement the increase in access to counseling services to those who work in critical care, not only nurses, but patient care techs, doctors, and other personnel that work in the hospital or in the ICU. A theoretical model that will be used is the Systems Research Organizing Model, or SROM. According to an article from the Applied Nursing Research Journal, the SROM is a kind of framework that identifies the relationships between variables of interest in healthcare. So these variables of interest can include health overall, the person, the healthcare professional, and the environment of the healthcare system. This model consists of four main constructs, including the environment, outcomes, client, and action focus. The environment is not what causes the change, but is considered a factor that affects the other three constructs. The client is what drives the model, the action focus is what measures the process, and the outcomes are the performance measures. This is a common image that is used to visualize the SROM. So in the SROM image, each bubble contains a construct of the model, and each arrow represents a relationship between the constructs. So in the middle, you have the arrows going from client to outcomes and outcomes to clients, because those are the relationships that can be made, are the clients, or say in this case, the nurses in the ICU, and then the outcomes would be the PTSD that occurred or developed. And then you also have the action focus and the context or the environment. Historically, the SROM has been used to identify and explore the outcomes of mental health of patients. Since the model has been used to explore mental health concepts, then this would be effective in exploring the clinical issue that is being discussed today. Furthermore, it is important to note that this model has previously demonstrated the promotion of health and wellness of the healthcare professionals, which is a goal of this clinical issue. The barriers that might be faced with the implementation of this theoretical framework may be that the environment continues to change and affect nurses differently and varying effects. To further explain, Nick James and Max Menzies in the Interdisciplinary Journal of Nonlinear Science discuss how the trajectory of COVID-19 is unpredictable. And predictive modeling of COVID-19 needs continuous observation of real-time data, which in this situation may not be attainable depending on what the resources are available. This is a barrier because at the peak of the pandemic or the peak of COVID-19, there was more trauma experiences, including extreme staffing shortages, inadequate PPE stock, shortages of hospital beds, and just nurses in general witnessing trauma and death every single day and every single shift that they had. At the lowest point of the COVID-19 pandemic, there might not have been the same experiences, so this could skew the ability to define relationships between nurses and their environment. This can be overcome by ensuring that the clients that are in focus or in the research are coming from the same environment or coming from the same time frame during the pandemic, or they worked during the same time frame. To discuss internal evidence, the term must be defined, and the authors of an article titled Evidence-Based Decision-Making, the Six-Step Approach, define internal evidence as evidence that comes from knowledge acquired from training, experience, and formal education. Internal evidence that will be used to measure the outcomes of this change project is the overall satisfaction of nurses with their position. So if the changes are effective, then the nurses that are the focus of this clinical issue may show an improvement in mental health, feel more confident in patient care, and show a desire to work. One ethical consideration that should be discussed is the notion of vulnerability. This concept has been explored since the Belmont Report in 1979 as an introduction to the need to protect patients or participants in research. Furthermore, the notion of vulnerability can serve as a possible way to identify those who are at risk for harm. Taking this clinical issue into consideration, the clients that could possibly be experiencing PTSD need to be protected as they may be vulnerable and susceptible to more trauma as they're experiencing it and discussing it and in interviews and for the data collection. The researchers in a qualitative study about frontline nurses working during COVID-19 discussed that if any time during their interviews that the nurses showed sign of agitation or depression, then the interview would be stopped immediately and counseling services were offered free of charge. Outcomes will be evaluated by post-interviews with the nurses. One study that was explored demonstrated the use of trauma screening questionnaires, which is a tool that is used to aid in the diagnosis of PTSD. Notice that it's a tool to aid. It is not an actual diagnostic test, but a tool to help clinicians identify risk. If this can be implemented before the change and after the change, then outcomes can be measured on a quantitative basis. There is evidence from a cross-sectional survey in the Healthcare Journal that lack of workplace safety and inadequate resources lead to mental health issues of nurses and directly affect the patient outcomes. With this information, outcomes of the change project can be measured through the analysis of patient health outcomes within the ICU throughout the change process. The dissemination of the findings from this change project will be carried out through social media. According to Daniel Gonzalez Padilla and Leonardo Tortolero Blanco, there is evidence demonstrating that the dissemination of scientific literature through social media platforms, including Facebook and Twitter, increases how much the articles are downloaded, cited, and queried. By using social media, dissemination of findings of this change project will be faster and have a larger reach in general. To end this presentation, I would like to point out that the future of the nurses in the ICU depend on what healthcare facilities can offer to prevent the negative impacts of COVID-19 and other pandemics that may strike in the future. If the mental health of nurses continue to decline without any change, then so will the patient outcomes. And that is something that needs to be considered moving forward in order to save facilities from future lawsuits, promote cost efficiency, and demonstrate that the facilities actually care about their employers, especially nurses, and their health and wellness. This is my Module 8 assignment. Thank you.